Hello, this is Jenny Larson. I'm going to show you a head-to-toe assessment as quick as possible. We're going to just go through head to toe on this newborn and what we're assessing and a little bit of why. When we enter the mother's room, we want to introduce ourselves, check for ID identifiers for the mom, check those against the baby, make sure that they match, that we have the right baby. We want baby in a safe place. Probably in the bassinet where mother can observe and also see what we're doing. We're going to have baby on a Chuck's pad in case they pee. We're going to have baby covered as much as possible during this exam because they can lose a lot of heat. Our first general observations are appearance, their skin color, their muscle tone, all of the APGAR assessments, their respiratory effort, their flex and tone, and general symmetry. And then as we go through, we're gonna be even more specific. For the skin assessment, we're looking for birthmarks, we're looking for pallor, we're looking how pink they are, if they have any acrocyanosis, which are blue hands and feet. We're looking for any jaundice appearance, which would be yellowing of the skin, any rashes, Mongolian spots, hair, vernix, all of those skin assessments. Okay, so we're going to do head to toe. It keeps us sort of moving through all of the systems. If we start at head and move down, we miss less things that way than bouncing around. So starting with the head assessment, of course, we have done hand hygiene and we've got gloves on. To do the head, we're looking initially at the suture lines, if there's any overlapping, if there's any molding, if there's caput, or a cephalohematoma. We're checking anterior and posterior fontanelles to check if they are open and if they are bulging or sunken or flat. We want to do all the facial features, checking for symmetry and normal anatomy. For the ears, we're checking for formation, we're checking for soft or firm, we're checking for how it recoils. We're looking for alignment of the eyes and the ears. It should be that the outer canthus of the eye is in line with the top of the ear. That would be a normal set ears. If we have low set ears, we may have a sign of a genetic condition. With the eyes, we're looking for symmetry, placement, a blink reflex. If we touch the eyelid, there should be a blink reflex. We're going to check red eye reflexes with our ophthalmoscope. Shining in the eyes, looking for a red, reflex coming back at us. And then swelling and any discharge. We're checking the nose for patency. We're checking the mouth, and when I check the mouth, I change my gloves because I've been touching their head, and I'm going to put a gloved finger in their mouth. So with new clean gloves, we're going to put a finger in their mouth, checking for the palate, assessing the palate if it's intact and complete, if it's high. We're looking at the gums for color and maybe a lip tie. We're assessing, I sweep under the tongue to check for a tongue tie. And then general shape appearance for cleft lip or palate, and color should be pink, okay? So moving down, you can check the clavicles at this point. So if they have, they should be symmetrical. We're checking for any crepitus or clicking or popping feeling, or that they are uneven, or if the baby is not using an arm in case there was an injury during birth. Okay, moving down to the chest area, this is where we're going to need our clean newborn size stethoscope. And we're going to check for heart sounds, rhythm, regularity, and any murmurs. We're going to be listening to apical pulse for 1 minute. We're going to be looking at nipples and size of nipples. We're going to be observing respiratory effort and if there's any use of auxiliary muscles or retractions during breathing. We're going to be palpating for abdominal masses. We're going to be listening for bowel sounds in the lower abdomen, and meanwhile observing the umbilicus for any signs of infection or discharge. If we need to remove a cord clamp, depending on the age of this baby, we may want to remove that at this time. Okay, I'm going to move the blanket up so the baby is somewhat covered while I do lower extremities. Okay, so we're going to feel for femoral pulses. We're going to check genitalia for females. We want to see whether the labia majora cover minora and the anatomy structure, if that is abnormal or not. For boys, we're looking for descended testes, scrotal rugae. We're looking for any abnormalities of the opening of the meatus, things like that. For girls, there may be discharge. We're going to check hip flexion, range of motion. We're going to check for dislocation on the hips here. And moving down to the feet, we're going to look at creases for gestational age assessment. We're going to measure that in thirds, so we're looking for how much the creases are down the sole of the foot. All the way down would be full creases. We're going to check for plantar reflex, a plantar grasp, which you press on the sole of the foot and the toes should curl. We're also going to check for Babinski reflex, which is stroking up the sole of the foot, and the toes should flare out. When looking at the extremities, we're going to look for symmetry. We're going to look for range of motion. We're going to look for any torsion, inward or outward rotation, any extra digits on the fingers or toes. Moving back up to upper extremities, we're going to check pulses here. We're going to look for symmetry and strength and flexion of the arms. We're going to check for palmar grasp by putting our thumb or finger in the palm of the baby's hand. They should grip, and you should be able to lift them off the bed from that strength slightly. We're going to look at the hands for palmar creases. We're going to move to spine, so we're going to turn baby gently over, and we're going to look for spine symmetry. We're going to look for, if it's straight, we're looking for a sacral dimple or opening, any tuft of hair. We're looking at symmetry of the creases of the legs for hip dysplasia. When turning baby back over, you will probably notice the Moro reflex or the startle reflex. Here we could do the stepping reflex by holding baby up, touching the soles of the feet to the floor, and elicit a stepping reflex for both sides. The other reflexes we're looking for are the sucking reflex, the rooting reflex, which we would have elicited when we were checking the mouth. With a measuring tape, we're going to measure head circumference. We're going to do chest circumference, abdominal circumference, and then we're going to do the overall length of the baby, head to toe. We do want to do an axillary temperature to make sure that during the assessment this baby hasn't been too cool. For the respiratory assessment, I do that usually when baby's on their stomach, and I can listen fully to the lungs. Listening to the lung sounds, listening for crackles, if the baby's still wet after birth, okay, and getting a respiratory rate from that. If the baby is doing any grunting sounds, nasal flaring, or retractions, we're going to note that also on our assessment. A few other things to assess, depending on the age of the baby, but really any time, is the number of stools, the frequency of stools, urinary output, so wet and poopy diapers, We would also check if the anus is patent. If they've had a bowel movement, we know that it is, but we may elicit a anal reflex by touching the anus as well. So that is a very quick head to toe newborn assessment.